My name is Dr. Ganesh, Veerabhadraiah. I am a consultant neurosurgeon, brain and spine. Today, we will speak about stenting. Stenting of brain. To know more about stenting, let us know about brain stroke briefly. What is brain stroke? Brain stroke is like similar to heart stroke or heart attack. What happens here? There will be an interruption of blood supply to the brain or part of the brain. We have heart which pumps the blood into all parts including the brain. Heart connects to the brain by two main channels, carotid artery and vertebral artery. If there is any interruption of blood supply to the part of the brain due to obstruction of these vessels starting from carotid artery till the distal branches of brain vessels, stroke can happen. What is the function of stent? Stent, when it is applied, it will facilitate the blood supply. Suppose if the vessel, example carotid vessel is narrow, the amount of blood supply passing to the brain, it will be very less. The brain will not be able to function adequately if blood supply is less even for a single second or few minutes. This stent will facilitate by increasing the diameter of the vessel. Hence, these stents play a very important role in preventing the major stroke. What this stent is made of? This stent is an alloy. It is combination of nickel and titanium. What are the indications for stenting? These are when there is a significant stenosis in the carotid artery or middle cerebral artery or any of the major vessel, we will do the stenting. This almost, if more than 70% of the stenosis of the vessel is there, stenting will be advocated and it will be useful. When other options are when medical treatment has failed and if there is repeated episodes of transient ischemic attacks are happening or significant stenosis is there, at that time we will do the stenting. Benefits of stent. Benefit of stent is like enhancing the blood flow and blood supply to the brain which is previously affected. Once this stent is placed, the brain will get adequate blood supply. When stent is placed, the major risk of stroke will be reduced and transient ischemic attacks by narrowed vessel is prevented and major stroke risk will not be there by brain getting the adequate blood supply. How stenting procedure is performed? Stenting procedure is also known as endovascular procedure, pinhole surgery or endovascular surgery. It is done in cath lab where microcatheters guide wires are used to see the narrowed vessel in the carotid artery, middle cerebral artery, vertebral artery or basilar artery. Once this is diagnosed, we will use the filters and microcatheters and guide wires will reach the area where it is stenosed, then we will cross the lesion, then release the stenting to enhance the flow. Side effects of stenting. These are contrast allergy, limb ischemia, hematoma at groin site, stent failure and contrast reaction. And what are the alternative procedures when stent is not possible? When stent is not possible, alternative procedure is carotid endarterectomy. Whenever there is a floating thrombus in the neck vessel and if it is floating, chance of clot going into the brain will be high. At that time, we will not do the carotid stenting. Alternatively, we'll do the small incision in the neck and we'll remove the clot directly along with the block. What happens after placement of stent? Once stent is placed, the blood flow will be good and brain will get adequate blood supply and oxygen. Future risk of transient ischemic attack and major stroke will be prevented. Usually, patient will recover in 1 or 2 days depending upon the pre-op neurological status. Most of the people will be discharged in a day or 2 or next day. We'll call for the follow-up after 1 week. If everything is normal, we'll ask them to continue the blood thinners. Thank you for watching stenting video. If you have any queries, you can get back to us, write to us, and you can call us by these numbers. Please talk to your doctor before deciding the procedure stenting and know the risks, benefits and advantages, disadvantages and all before undergoing the stent. Thank you for watching. Have a nice day.